One of the things that I like to look at public health as doing is we all do the same thing, but in a different way. And the different way depends on what our community needs.
You can work in a hospital setting, different clinics, different agencies. You can work in soup kitchens, you can work in shelters.
Any type of field in the social service field, so counselors, therapists, social workers.
There are positions at the hospital for care coordinators, and those folks will make referrals, external referrals, but they'll also help that patient navigate through a very complex hospital system as well.
What I do, I work with the population coming from prison who have chronic illnesses. One thing I could guarantee the guys when they come out, you're going to see a doctor. If you need your medication refilled, your medication will be refilled.
It's nice to have somebody that, genuinely cares and leads them and shows them the proper channels to go through to make improvements. And just to know that someone is on their side and that their voice matters.
If you've never had to seek services before, you may not know how, or you may be more nervous or apprehensive to go out there. So when we come to you, when we're sharing our information to you, it makes us a little more approachable and reachable.
Being a community health worker, you're helping people in so many ways, and that's something sort of what I've been doing my whole life. Because growing up, I knew English, and like in my household, I knew English, so a lot of people didn't know English in my household, so I would always help them. And there's something so similar to that, and I just said, wow, I can take this opportunity and actually become a community health worker, become a professional at it.
And the people that come into this field are people that have decided that this is a calling for them, it's a vocation. And I mean, it certainly isn't that you're going to make a fortune, you're not going to get rich doing it, but most of the people that enter this field do feel that they have a calling, and those are the people that I'm drawn to hire, are the ones that feel very committed.
When you're trying to achieve a goal, I think it's more motivation to you if you are in touch with what you're trying to obtain. And being from the community and trying to become a community health worker is an asset to you. You know that partner expression, failure is not an option. You know that people are counting on you to make a difference. And then when you're looking at coming to the health center, you can hold your head up saying, I'm trying to fix some of the problems you have with the community. And it connects you to the community in a special way.
I think a community health worker that knows the community is a very successful community health worker. They can be that bridge between cultural competency, the language that are speaking, the beliefs in the community. So if one lives there or was brought up there, I think that they know that coming into being a community health worker. However, we've also seen a lot of successes with people that have been willing to go in and get to know the community.
This is my comfort zone, and I have a lot of resources here, and I've met a lot of people through outreach, but I'd be happy to go to any community and do the same thing.
And with Gateway, that's an opportunity for you to go to school and come back in your community and work at a community health center. Work for outreach, work at a front desk, learn to be an office manager, and give you your niche to be able to fix some of the problems that are happening, in the community. You're actually going to be problem solving real issues, not things that are coming up in theory or nice to talk about, but you're going to be dealing with real life issues that the patients have on a regular basis.
As a CHW, I think it's just the beginning to an open door of opportunities. So, in doctor's office and social service settings and different companies, everybody needs some type of advocate, liaison, support system.
Having that certificate, I believe, would make you more employable because it shows that you put in the time and the commitment and you have the interest and the compassion to work in this field.
There's lots of opportunity, and it's important.